Dr. Malenga, how uncomfortable is this for the patient, and what can we do to make it more comfortable?
So that's always a good question, a key consideration. So here are the components of that. First, putting in an adequate amount of tumescent fluid is really important. So depending on how you're going to do it, anywhere from 200 to 250 milliliters of the tumescent, more is better to try to get it to the tissue to feel sort of tense underneath your skin. So that gives you an idea you've put in an adequate amount. Part number two is actually give it time. So give it at least 15 minutes of settling in there. And, 15 minutes doesn't sound like a lot, but it can be a fair amount of time. So in that time frame, you can do other things, engage the patient a bit, tell jokes, things like that. So those are the first two components of getting it set to be more comfortable. Then beyond that, most of the time it's really well tolerated, but there are areas where there's some tissue that is adherent, so subcutaneous tissue that can be adherent to the adipose, and those might feel pinchy. So I usually tell the patients there are going to be perhaps some times where it feels a little pinchy, a little more uncomfortable. So you tell me if that's what you feel. And if they feel it in that area, just try to avoid that pocket of an area and ask the patient to give you feedback and let you know how it's going.
Dr. Sampson, do you provide any medications before the procedure?
Sometimes it depends on the patient. Oftentimes many can tolerate this without medications, but we can provide sometimes Tylenol with codeine or a Xanax or Ativan. And we've also used nitrous oxide gas, which helps reduce anxiety and promote patient comfort and allowing me to focus on what I need to do and the patient just to relax.